Dear colleague, welcome. It's Dr. Jack here with Dr. Jeff Bostic, and Dr. Bostic is going to talk to us about depression and some highlights from 2019. Dr. Bostic, over to you. Just tell us whatever you think is the most important.
Well, the big thing that's going on is, we've always appreciated that combined treatment, if you will, some kind of psychotherapy such as cognitive behavioral therapy, plus the medicines work better than the medicines alone. Okay, great. But what really has turned out to be very pertinent about this is people like Abdallah, who's been doing research now for the last couple of years, has illuminated that it's like the stress and the distress that people experience, you got to really do something about that also. So all the CBT kind of tactics and strategies that people learn are great, but it's like similarly like exercise, coping with stress, all those things turn down the damage that stress and distress is doing to your nervous system so that the medicines can then be most helpful. So we're increasingly appreciating that it's not like, someone's come in and they have a problem, so we can give them a medicine that will perturbate their system and get them all better again. It's like, you've got to go after both what's leading to them being vulnerable to having this condition, as well as also giving them agents to frankly help them repair their brain, to trigger the formation of new brain cells while you're teaching them the strategies to burn the right tracks in these new brain cells that they're deriving from being on these medicines to really get the most benefit.
I love that conceptualization, because the way I look at psychiatric disorders, they're really the culmination of a life that's gone off balance in some way. But there's a whole history to it. How do you get to the point of needing to see a psychiatrist? And by giving someone a pill, yes, it could certainly reset the brain, but all of those vulnerability factors, risk factors are there, right? And then how do you address them directly? So I'm so pleased that we're waking up to that.
Well, we were joking about it today when we were talking in the conference, and which is an extremely good experience because everybody comes with their different things that they're already learning. And so concretely, one of the things that we've come to appreciate is it's not just like the cognitive behavioral kind of therapy strategies that you use to manage when you feel depressed and despondent. It's turning into probiotics. It's like we know that the second biggest area of serotonin receptors after the brain is the gut. Perturbations there, differences there, anomalies there probably increase your vulnerability. So there's this whole biological spectrum of how vulnerable you are to whether it's depression or a variety of other psychiatric conditions, and there's environmental stuff. And the point is, first, you want to target both, but it's like you want to target both a lot. So it's like, it's what they eat. What are we doing about sleep? We're spending more of our time now talking about different environmental things that people can do to ensure that their sleep is stable and good quality, again, so that they're in the best place to benefit from the medicine treatments. And the same thing again, of course, with exercise. It's become a huge variable. We're seeing it both with team sports and individual stuff. It really diminishes one's vulnerability and or helps them recover more quickly when they can do even small, simple things.
That's wonderful. So for the clinician who is really pressed for time, and almost everyone is pressed for time, what is a good entry point to start, even during a med administration session, maybe limited to 15-20 minutes? What can the clinician do realistically that will start moving that patient in that direction? What's your advice?
Two things. The clinicians are typically very smart and adept at going through the algorithm of what medicine would be the best fit for this patient. That's something that people are really good at doing very quickly. We jokingly talk about the relationship being the thing, but increasingly research has demonstrated this over decades, that you only get so much better on the medicine, but you get a lot better by just seeing the psychiatrist, by keeping up with things. So here's the relevant clinical part. We're looking to do two things differently. First and foremost, we're moving away from how's your sleep, how's your depression this week, are you still feeling suicidal? Historically we would go through the criteria for the pathology, and that would be the focus of the conversation. Now still we want to capture that, but you can capture that quickly with rating skills that they fill out in the waiting room, or again, typically it's like, what are the big things? But then augment that with what we're now calling focusing on the positive, which are, you should have something that you're conversing about with every patient about something that they're growth oriented about, whether it's sports, music, they're interested in movies, whatever it might be, so that there's something that they're burning in their brain other than every time I see the psychiatrist, I associate that with my depression and my anxiety. So it's like that thing I think is helping us move into a more health promoting aspect of living with these chronic mental illnesses. You don't typically have one burst of 3 months of depression in your life and then you never see it again. You may have wide intervals in between it, but it's like doing all the healthy things in between should diminish the frequency of events, of episodes, and the intensity of them. So building that in, and our other joke has recently been, quote, PERMA, the positive emotions, so specifically when they're doing even the med check, how's the medicine affecting like your joy, your serenity, your positive emotions, not just the negative ones. How's it working with your engagement with others? How about your relationships? Are you noticing that those are better or worse? How about your ability to accomplish stuff at school? Meaning, do you feel different? Does it mean something to take a medicine? Because kids will say, oh, I'm worried that this is changing me as a human being. And it's like, well, really? Maybe, but is it doing things that are helping you like explore things that you didn't think about doing before because you feel more courageous or you feel better and more confident, like jumping into other domains?
I love it. I just wrote a blog post article called Nurturing Our Patients' Resources.
Yeah.
And I think it's there, people have some resources they're already using. Other resources are latent, but we never say like, well, what else, what can your sister do to maybe help out and give you a little bit of child care so you can have some respite? Or just as one example, like we don't focus on the resources, the strengths and positive things that are there, but no one really thought about it. And as clinicians, we can say, hey, but what if we nurture those things? It may take a little while. Some things are on the surface. It's like, just go ahead and do it. Other things, it takes a little bit of work to bring them up.
Well, I haven't thought of it that way before, but I'm going to steal that brilliant metaphor because we always joke about or talk about, looking at our patients like flowers and we're waiting for them to bloom and to bud. And now our treatment focus is shifted toward what can we do with the soil? How can we do parent management stuff to help this plant grow? But better, your analogy is more to people are a garden. They have like musical propensities. They may have interest in the arts or sports or how they connect with other people. So it's like you have things blooming all the time, in your garden. And so it's like there's some things that are
And if they're not
latent.
blooming, there's things you can do. You check the acidity or alkalinity of the soil. You get some mulch. Right?
But it's to be thinking about like I want a bunch of different things in this human being, particularly young people, to bloom so that they can make the best decisions for their life, career-wise and relationship-wise. So thinking about that as these latent things out there that we haven't necessarily addressed, I think is actually a very, very smart
what
idea.
I like what you just said that expands my thinking. Again, it's a person isn't just a flower, they're a whole garden because there's so many facets to us. And we may be blooming here, but not really blooming there. And there's ways of really expanding our awareness in ways that the person can in some way flourish. I think that's another really good word that it's good to incorporate into our clinical terminology.
Totally agree. So thanks for spreading the idea.
I loved your talk, so thank you so much. Thanks
you.
for being part of this.
It was great. I had a great time. Thank you.
All right, thank you. Thanks.